Members, it's the appointed time. We have a quorum. I call to order the meeting of panel on health services. Let's proceed with the election of chairman. The Secretariat has issued a notice to members informing members that at the end of the nomination period for the office of chairman of the panel, only one valid nomination was received. The nominee is Dr. David Lam. The nomination was made by Professor Chan Wing-kwong and seconded by Ms. Chen Ho-yen. Because Dr. David Lam is not a chairman or deputy chairman of any other panels or a chairman or deputy chairman of any relevant government advisory bodies, in accordance with the rules of procedure and House rules, I declare Dr. David Lam duly elected as the chairman of the panel in this session. Dr. David Lam, please. Thank you, members. Let's proceed with the election of the deputy chairman of the panel. The Secretariat issued a notice to inform members that at the end of the nomination period for the office of Deputy Chairman of the panel, only one valid nomination was received. The nominee is Professor Chan Wing-kwong. The nomination was made by me and seconded by Ms. Chen Ho-yen. Because Professor Chan Wing-kwong is not a chairman or deputy chairman of any other panels or a chairman or deputy chairman for any relevant government advisory bodies, in accordance with the rules of procedure and House rules, I declare Professor Chan Wing-kwong duly elected as the deputy chairman of the panel in this session. Congratulations. Okay. Right. Let's move on to the second agenda item. Schedule of meetings for the 2026 session. In the 2025 session, the regular meetings of the panel were held at 10:45 in the morning on the second Friday of each month. If members agree to continue to adopt the previous arrangements, please refer to the proposed schedule of meetings for this session before you. Any comments? If not, please note that because the second Friday in March is when the two sessions will take place, so the regular meeting in March will be held at 8:30 in the morning on 20th of March, Friday instead. If members have no questions, we'll move on to the third agenda item, items for discussion at the next meeting. First, policy briefing. For members to get a better understanding of the policy directions of the government, the Secretary for Health will hold a policy briefing between 11:30 in the morning and 1 p.m. on 30th of January, Friday. As for the next regular meeting will be held at 10:45 in the morning on 13th of February, Friday. The administration proposes to discuss the two following items: the development of Chinese medicine and the reform of the Medical Council of Hong Kong, and proposals to amend the medical registration ordinance. Do members agree to discussing the two items? If there are no objections, we shall discuss the two items. Members, please also note that for the benefit of members getting a better understanding of the topic of Chinese medicine development, the administration has invited the panel's members as well as all other Legislative Council members to visit the Chinese Medicine Hospital as well as the Government Chinese Medicine Testing Institute. The tentative date of the visit is 9th of February 2026. If there are no comments, the Secretariat will discuss the arrangements with the administration and issue a notice to members later. We shall now discuss the items for discussion in this session. We have members who have pressed the request to speak button: Professor Chan Wing-kwong, Ms. Jovi Chen, Mr. Chong Ho-fong, Dr. Chen Han-pen, Mr. Holden Chow, Ms. Grace Chen, Mr. Kingsley Wong, Ms. Chen Ho-yen, Mr. Chu Lap Wei and Ms. Christine Fong. 2 minutes per member. Professor Chen Wing-kong. Thank you, Chair. I would like to thank members for electing me as a deputy chairman of the panel. I hope that we could discuss the following items in this session. First, I hope that the administration can report to this panel the reform proposals for fees in the public healthcare system so that we can review such and raise any suggestions for improvement. I also would like the administration to report on the latest implementation progress of the private healthcare facilities ordinance and discuss with members how to combat illegal practice of medicine to protect citizens. Thirdly, last year, the administration amended the Supplementary Medical Professions Ordinance. I hope that the administration can give updates to this panel on cross-disciplinary medical professional referral arrangements. And I want to talk about also for the fourth point that we have made multiple legislative amendments last year, for example, non-local admission pathways for medical professionals. I hope that we can get an update from the government. Thank you. Ms. Jovi Chen. Chair, I would like to follow on 2 items, and I would like to raise 2 new items for discussion. We have some new changes with supplementary medical professions. It is very important for primary health care. I want to look at the implementation progress of collaboration of different medical disciplines. We have also some women health services consolidation since last year. I also want to see what the progress of implementation is. The 2 new items for discussion. First, on application for concessions on medical fees. I actually helped some elderly persons fill in forms in my district, and I can see the procedures are quite complex. So I want to look at the application data, success rate, how many applied, the coverage, to see if it fits with the policy intent, to see if we need to expand the scope of concessions, and maybe we can digitalize the application procedures also. I also want to say Nansha is a region that has received great support of the country for biotechnology, and they have great institutional advantage as a result. They have a cluster of over 400 biotech enterprises covering some very advanced cell therapy. I believe Hong Kong can act as a bridge, and if we work with Nansha, we can really help patients, and we can also help enterprises go global. I hope that we can facilitate realization of research outcomes and international cooperation. If the panel is to go on a visit, we can perhaps visit Nansha to learn from their experience and make good use of their platform. Thank you, Chair. Thank you, Mr. Chong Ho Feng. Thank you, Chair. I would like to follow up on the financial situation of the Chinese University Medical Center, as well as their plans to see if they can pay back the government on time in 2028. I also want to follow up on what the chairman of the hospital authority said in the middle of last year to have an accountability system for patient safety. I want to follow up on the implementation of such system. Thank you. Dr. Chan Han-pan. Thank you, Chair. I have 2 points to make as we see the Northern Metropolis flash out. We are looking at the industrialization of Chinese and Western medicine. And if we are to have a drug registration bureau in future, this will play a key role. So in future, I want to talk about the topic of development of Chinese and Western medicine industries. 2, on rare diseases. I hope that since we last discussed this quite some time ago, we can follow up on the register of drugs and treatment for rare diseases to see if there's any update. Thank you, Mr. Holden Chow. Thank you, Chair. I would also like to make 2 points. In fact, with the increase of the fees in the public healthcare system, there's an increase in the burden on the people, so we can perhaps have the government study or discuss with us how we can better help needy elderly persons and simplify the application procedures. And this morning, we actually discussed this at the panel on welfare services meeting because this is somewhat related to the Labor and Welfare Bureau because medical social workers are dealing with the application. So I think we need to discuss this at the panel on health services as well. As for the hospital development plan, it is a 10-year plan. Due to different reasons, we have seen some delays. So can the administration give an update on the latest situation on the 10-year hospital development plan? As for the second 10-year hospital development plan, it is already planned even when we're still in the first 10-year cycle. Will we have any updates about the second plan? That's my second point. Thank you. Ms. Grace Chan. Thank you, Chair. I agree with what other members said about public healthcare system fees. I would also like to follow up on community pharmacies as well as mental health service resources and specialist outpatient and support services. Lastly, dental care for intellectually disabled persons. Thank you. Mr. Kingsley Wong. Thank you, Chair. Many members talked about the reforms of the public healthcare system fees. We have received much feedback from the people, so I think we can really discuss this in the first half of this year. One is with the waiver of fees, and for the elderly, right now there is a cap of $10,000. I think with the implementation, we should really have an item for discussion to look at the actual situation. Second, we can also talk about enhancing cross-boundary healthcare. First, can we expand the coverage and subsidize some surgeries as well as for rare diseases? Can we have subsidies for people to purchase drugs or medical treatment to alleviate their burden in cross-boundary healthcare? Thank you. Ms. Chen Ho-Yan. Thank you, Chair. First of all, we really need to follow up on the situation after the increase in public healthcare fees. The government said that they have achieved good results with different data, but then from what we heard in the community, we have heard feedback on the waiver applications as well as the increase in the burden on the people as well as service quality. We shouldn't only look at the figures because while we do see less people going to the accident and emergency department, there may be other factors. We should look at the other factors as well. I also want to look at whether there is an improvement in the waste of drugs. And sometimes when there are 4-week cycles, people would just come 2 weeks later, but they are given 4 weeks drugs. So we really need to make sure we look at that situation as well. As for the second hospital development plan, we have seen the consolidation of the Island East and Island West clusters. But then we need to make sure with funding approved, what will happen with the existing funding and what's going to happen in the second hospital development plan. As for voluntary health insurance, last year we have been talking about there will be a large-scale review of voluntary health insurance. So what will happen? What is the latest progress? We talked about having a high-risk pool as well, body checks. So can we receive a report from the government? We also have a family health integrated center plan, but we have not talked about the positioning and the plans. Can we talk about that in the council? Thank you, Mr. Chu Lat Wai. Thank you, Chair. I very much pay close attention to the development of primary health care. And in the primary healthcare blueprint. If we can develop it comprehensively in the community, it can really enhance the health of the people, and we can take a prevention-oriented approach. I hope that we can follow up on the implementation of the blueprint. We have also seen in recent years district health centers playing a key role in the community. I hope that in this session we can talk about how we can enhance the functions of district health centers in the community. Can the centers be more proactive? Can they work with other departments, social welfare organizations, so as to enhance people's health and allay the burden on the public healthcare system? Ms. Christine Fong.
Thank you, Chair. For Kowloon East and the overall hospital development plans, I want to be given a briefing. I agree with members that in relation to the streamlining of the public healthcare fees and charges reform, as well as the scope of the waiver, I think the waiver should be enlarged. I'm also concerned about the frontline officers' classification of the fees, whether that should become Class 1 or Class 2. And then this panel should also look at the future of an animal hospital in Hong Kong. Will that be covered by this panel? Another point is about promotion of primary health care for chronic disease. I think there is a scheme to look at that. I think it has been quite successful to a certain extent. Any other members wishing to speak? If not, then myself and the Deputy Chair, Professor Chen, will hold a meeting with the administration concerning the work plan for 2026. We will take up the proposals you have just made. And then in relation to subcommittees on policy issues, the House Committee Chair already told you at the House Committee meeting last week that under the House Committee and under panels, there are certain basic principles to abide by if you would like to set up policy-related subcommittees. After getting all the proposals from all the panels, etc., then there will be a holistic view concerning the priority of the proposals. If members think that under our panel we should set up subcommittees to study policy issues, that is specific issues that have attracted wide public attention, then by 5 p.m. on the 6th of February, a Friday, please forward your written proposals to the clerk covering the terms of reference, the time schedule, as well as the work plan, among other items of information. Please note that for the membership limit of subcommittees on policy issues under panels is 20. Moreover, the membership should have more than half of its members from the panel itself. Non-panel members may also join, but then they mustn't outnumber the panel members. AOB, the clerk will continue to provide sign language interpretation for our meetings. As to the joint panel meetings covering the health services panel and other panels, as well as the subcommittee meetings, we'll provide the related service on a need basis. I haven't got any other proposals to talk about, so with the AOB meeting adjourned.